Governor Roy Cooper joined the United Health Foundation at East Carolina University today to announce a 3-year, $3.2 million grant.
The money will help the North Carolina statewide telepsychiatry program reach underserved rural communities. News Channel 12 Star Connor joins us now live with why the program is so important.
The program is so vital because that program will help serve mental health services to underserved children in rural parts of the state. Now, that's something Governor Cooper and other top officials say is desperately needed. According to a study by the Centers for Disease Control, around 60% of teenage girls had a high level of anxiety in 2021, and 1 in 3 had suicidal thoughts. Governor Roy Cooper was in Greenville talking about those mental health challenges in our children.
Adolescents are showing so many signs of stress these days. Clearly, social media can be one place. School is another. Dealing with the pandemic is another. So we know that there is a lot of pressure on children, and we know that their mental health can be adversely affected.
His grant will allow an expansion of telepsychiatry to provide mental health services to underserved children in 6 community-based pediatric and primary care clinics in rural and underserved parts of the state. It's a partnership with United Health Foundation and United Health Group.
This is huge for Eastern North Carolina. If we should do anything, and that is make sure we give our children a fighting chance to be successful in life. And indeed, we've been doing it here with the NC STEP program, tackling the challenges of accessibility.
And in today's day where mental health for children and the crises that's hitting our kids is exploding, this is an absolute game changer as far as being able to get access to kids for mental health services throughout the rural Eastern North Carolina.
Dr. Saeed, who will be head of the 6 locations, says children visiting the clinics will feel comfortable and have full attention based on their needs.
It will look just like going to see your pediatrician. They walk in a pediatric clinic where they see their pediatrician based on, and this is a health model based on primary care. So everybody who comes to the clinic gets a screen. So it's not just the kids who say I'm anxious or depressed. We screen everyone, and based on that, whatever the needs are, we provide that service within that clinic.
According to the Rural Health Information Hub, more than 70% of children with a mental health disorder do not receive treatment, and 92 out of 100 North Carolina counties are designated as mental health professional shortage areas. Now, Dr. Saeed says they plan on going live with their new 6 mental health clinics on July 1st. The locations of the clinics have not been determined yet. In Pitt County, I'm Star Connor for News Channel 12.
Star, thank you. And News Channel 12 caught up with the governor after that event. We got some answers on a number of questions, from the balloon shot down off the South Carolina coast to the controversial Parents' Bill of Rights. Governor Cooper is signaling now that he'd vote along party lines against the bill and saying the legislature should be focusing on staffing shortages.
I do not support the Don't Say Gay bill. I think that marginalizes people. I think that the legislature should be working on making sure that we've got teachers in every classroom, making sure that we got bus drivers, and making sure that we invest in public education.